The liquor industry says government's decision to ban liquor without consultation and consideration is severely affecting traders. Tavern owners, 54% of which are women, say they are more concerned about facing poverty than contracting COVID-19. The Gauteng Liquor Board hosted a Women's Day summit in Soweto earlier today to unpack their challenges.
We're coming to you once again from Meadowlands in Soweto, where the Women's Month Summit has just concluded, that was hosted by the Gauteng Liquor Board in association with Diageo. As I had mentioned earlier, that women who are tavern owners were here for this summit just to, be in discussion and in conversation with the Gauteng Liquor Board, discussing and unpacking their challenges that they have faced. As we know, amid the lockdown, they were not allowed to, sell their liquor and make ends meet. The only way they know how. We've had conversations with a few of the owners here who've just filled us in on the challenges that they're currently facing. But to speak to me more about today's event, the summit, as well as quite a lot that he had mentioned on the podium when addressing the women here, I have with me Sibani Mngadi, who's the Corporate Relations Director at Diageo South Africa. Thank you so much, Mr. Mngadi, for your time. You said quite a lot on the podium this morning regarding your views on the lockdown regulations, the way in which things were conducted, especially with the announcement or communication made by the government. But let's just start off with what you have seen on the ground, how it has affected traders, as more especially the women that we saw here today.
Okay, maybe let me start here on the issue of women. As Diageo, we are a global company leading in spirit, and one of the things we pride ourselves on is diversity and inclusion, and gender equality is one of the critical things we do. And we have been doing this with the Gauteng Liquor Authority. I think it's the third year now that we observe this occasion. And unfortunately, we are observing the Women's Day today with trade not happening, and it's painful to hear the plight of women of Soweto in terms of the difficulties in getting income as a result of their trade not opening. And of course, the most difficult thing is the lack of consultation or even a warning in terms of the closure. If we understand that taverns will have procured their stock on Thursday and the trade was closed on Monday with immediate effect, which means people were left with stock that they will not be able to trade. As to whether they will be able to get back to business again, it's difficult to foresee, but as a company we will do our best to support those who are our customers.
We also heard some of the points that were made regarding some owners who took loans to try and purchase the stock that they had to sell while the ban was lifted, and now they're finding themselves in a challenge where they're struggling to pay back those loans, struggling to make ends meet just to feed their families right now.
Yeah, we are hopeful that the government will relook at the issue, because really the more it drags out, the more it's difficult for many of the tavern owners in the townships to recover. People have to make difficult choices where they need to get groceries. That was one of the biggest things that came from this summit, that people are not even meeting basic needs of their families, and it's worse that businesses have had to take loans and they need to service those. But I will say, from the producer's side, we will do our best to, at the opportunity at which we are able to open, to support those customers or those taverns as much as possible. During the first opening on the 1st of June, we went out of our way to support in terms of PPEs and sanitizers and various other things we could do to reach out to the 35,000 taverns in the country. We will do our best again to make sure that at least they open in a more safe environment, and I'm hopeful that most of the companies in the sector will look at what are the best possibilities, payment terms for people to be able to get stock and start all over again.
You also shared with us some of the numbers, you discussed some of the numbers with regard to the losses that were made or the losses that we're currently facing, how this is impacting the economy, how the Department of Health as well, how they factored in that the sale of alcohol or liquor affects the issue of hospital beds. You had quite a lot to say about that. Can you please elaborate on that more, and how or why you think their justification, for lack of a better word, was a bit Flawed with regard to the numbers that you're seeing?
Yeah, I think the concern there is the report or the research that was done to justify the decision, which came from the Medical Research Council. We have reviewed that report, and clearly for us it's clear that there were shortcomings in it. The first part is the calculation of the hospital capacity that is there in South Africa. 1999 data was used, which means most of the hospitals that have been built in the past 20 years were not taken into consideration, which reduces the base at which you calculate. The second part is the number of people coming into the hospital with trauma. Currently, the hospitals don't test people for blood content as they are admitted for whatever reason. And in this case, the 50% estimate was put in to allocate to alcohol, which we think, it's not referenced in any way, and then it might as well be overestimating the situation. And the reality as it stands now, that the provinces that were expected to have a higher number than the beds they have, Gauteng in particular, the Premier in Gauteng, Premier Makura, has reported bed occupancy of 57%. Western Cape has reached its peak. It's beginning to level off and even decline, and it is doing that at about 70% according to the report from Premier Windy on that side. So we do believe that maybe there is scope for government to begin to look at the livelihoods, because it's becoming clear that at least in the current situation the lives have been able to be saved to a certain extent as a result of effective delivery of bed space and effective health service to people.
We heard Lucky Ndimane from the Traders Council speaking to us about how they haven't had any communication with government, and government has not responded to the letters that they had sent regarding this matter. Is this a sentiment that you share as well? Is this something that you've also experienced in your communication with government, and what is the way going forward now with regard to communication with them?
Yeah, for us as manufacturers, yes, at the beginning it was quite difficult, but I think we have reached out to different departments. Department of Agriculture, we have had meeting at least with the wine sector, where much of agricultural effect comes in, particularly with the growing of grapes for wine. I think there is greater understanding of what the impact is among small grain growers that become part of the ingredients of alcohol. And we have reached out to National Treasury and requested delay in the payment of excise tax that we needed to pay for July and August. And we are grateful that the Minister has responded positively, giving us 90 days within which to pay those amounts. That brings us a lot of relief as manufacturers. We are in conversation with at least the Department of Trade and Industry to come up with proposals on how we can at least potentially get back to trade in a more safe environment, and the commitments that we are making in dealing with inappropriate use of alcohol. And we have gone as far as committing certain amounts of money. For instance, we understand on drinking and driving that the issue that is facing government is the ability to process blood for it to be used for prosecution. On that front, we are happy to build facilities for testing of blood and the results can be submitted to for prosecution, and we can do that in all the provinces. And we have piloted that project. It spends about 1.5 million per facility, and we can do it in all other provinces. And all that is needed now is to engage with all of government, all the parties involved, and hopefully look forward to some opening in the near future.
Thank you very much. That is Sibani Mngadi from DHA, just speaking to us about, the discussions that they've had with government with regard to the sale of liquor and the trading of liquor, again, the impact that it has had on the economy, the impact that it has had on the people on the ground, and the women that own these taverns, for example, that we saw here, who make up 54% of the sector, just speaking to us about, prospects and of the future and what their communication with the government will look like going forward. But that is it from here. Back to you in studio.